Johns Hopkins says 6.5 million people worldwide have died from COVID-19. More than 1 million of those people died right here in the United States. Looking back, I mean, what were the mistakes that the US made?
Well, we don't really single out countries, but what happened in many countries was there did not seem to be early on a recognition of how dangerous this virus is and a recognition of the level of illness people would suffer, that if you had large numbers of cases, it was simply a numbers game. If you let the virus transmit in your community, you would then have, even if it was only 10% of people who got sick, that would rapidly overwhelm your health system, and that meant many people who couldn't get treatment were also likely to die. So that would raise your death rate. And we've sadly seen this in many, many countries over and over. And the really strong message for all countries, and we have seen enormous loss. I don't know anybody who hasn't lost somebody in this pandemic. The real lesson is get your health system to a strong level, and by strong I mean a level where every person in your population can get good basic health care, can get to a doctor, can get to a hospital, can get the right safe medicines when they need it.
What is your assessment of the program that was put in place right at the outbreak to raise public awareness of what the pandemic was about, how fast it was spreading, and the measures that could be taken to counter the spread of the virus?
Certainly, right from the beginning, again, we used very much public health communication. That was been very much my job. And we had daily press conferences, in fact, to inform the public. We also asked our experts to go into all kinds of social media, to do things like social lives, and listen to the questions of the people and understand what they were thinking, to help people understand better that this was a very serious matter, and to give them autonomy, to give them the ability to make the right decisions to protect their health.
Right now, the WHO, of course, is looking ahead. Dr. Ghebreyesus is proposing what he describes as a game changer, a project that will entail sweeping changes to global health infrastructure. It will ensure, and I'm quoting here, scientific and political cooperation across borders before, during, and after an outbreak. What can you tell us about this initiative?
So right now, we've got a lot of initiatives. We already started something called the Berlin Hub, which is a hub for looking ahead to try to understand any signal that's out there and see what it's likely to do. But we're also leading and coordinating an international technical consultation to reach a consensus with global issues on what we can all as a world do to be really prepared, and not just prepared, but the minute we understand a true emergency's there, work together. This is what failed this time, but we can't keep on doing this. It's been described as a cycle of panic and neglect. When we don't have a large emergency on, people sort of seem to go right back to normal. But preparedness is critical for saving lives and preventing this kind of pandemic. It's a bit like housework. You don't notice it unless it's not being done. And when it's not being done, things are really, really bad. Preparedness is absolutely key. So we've got this international negotiating body working right now, and we're taking a lot of submissions right now to look at how can the world really, genuinely get together when there's an emergency on and do what needs to be done.